It was a historic moment earlier this week when the country's first 1 million doses of COVID-19 vaccines arrived on South Africa's shores. Now the Health Department has introduced an electronic system which will allow for the process of registration. Minister Zweli Mkhize says some healthcare workers have already made use of the portal.
The system can capture the relevant metrics of all South Africans that will be vaccinated, ensure vaccinees are contactable and alerted to optimize adherence to the vaccination regimen, and complete the certification process such that the vaccine certificates are easy to obtain for vaccinees and authorities that may require certification.
The minister says all healthcare workers in the public and private sector should make use of the system.
In the event that a healthcare worker has not self-registered, you will not be denied vaccination. You will be registered at the vaccination site. It must just take a few minutes longer. We would, however, encourage all healthcare workers to register before the inoculation call, because this will help us to know how to refine our current allocations and get enough vaccines to the right vaccine centers at the right time.
While the system has been welcomed, this health analyst says an online platform can face challenges.
As with all electronic systems, the system could potentially crash, although the health department indicated that this specific system is on a platform where 59 million other records are also being kept, and that it has a large capacity and is unlikely to crash very easily. But then one of the challenges that crime-fighting organizations around the world have been warning about, that is a big threat for vaccine rollouts, is online crime. It is criminals in the form of hackers getting into a system and tampering with the data. And that has certainly been something that Interpol, for instance, has issued quite a few press releases and media briefings about. And that is something, we would need a very good security system so that no one can get into that system and tamper with data.
Meanwhile, tech analyst Toby Shapshak says this option is not a difficult task to undertake.
The system that the government wants to use is a very simple database. Personal details, where you are based, and your choice of 200 locations that are closest to you. This is a very, very simple database with maybe 10 or 20 fields of data per person. It's very hard to get this wrong, and it's very hard to pay lots of money to do this. It's not an expensive undertaking. People do this kind of thing all the time and know how to do it safely and securely. So as long as the government uses a reputable company who does this, who actually does this and did this before COVID, and isn't a tender being won by a friend or a cousin or a somebody of a politician, then we should be able to trust it. I mean, it's the government. We're supposed to trust them, right?
Government is expected to vaccinate around 1.2 million healthcare workers, including traditional healers, in phase 1 of the vaccine rollout plan. For Newzroom Afrika on Channel 405, I'm Mbali, Thethani in Johannesburg.